So this topic is about the dynamic retinoscopy. First of all, we will discuss about that what is actually the retinoscope. You know that the retinoscope is actually an instrument which is used to find the refractive errors objectively, right? The autorefractometer and the retinoscope are the instruments which are used to find the refractive errors objectively, right? And we have many videos, we have many lectures on subjective refraction as well, right? So in this video, this lecture is about the dynamic retinoscopy. There are two different types of retinoscopy. The first one is called the static retinoscopy, and the second one is called the dynamic retinoscopy, right? So first of all, we have to know about the major difference between both of these types of retinoscopies, right? So what is actually the static retinoscopy? You know that the static, as the name implies, that the static means it is fixed, immobile, it is not moving, right? So that's why it is called the static retinoscopy. So what is actually the static? In static type of retinoscopy, you know that the accommodation is static, accommodation is fixed, means the accommodation is at rest, accommodation is paralyzed. So in all types of static retinoscopy, we have to keep it in mind that accommodation should be at rest. Either we make our patient to look at distance, so the accommodation of the patient will be at rest, right? Or we will use the cycloplegic drugs like atropine, like cyclopentolate, so that we can paralyze the process of accommodation. That type of retinoscopy is called the static retinoscopy. And in the other hand, the dynamic retinoscopy. And you know that the dynamic mean it is not fixed, it is not static, it is movable, right? So in this type of retinoscopy, which is called the dynamic retinoscopy, the accommodation is not static, the accommodation is moving, the accommodation is exerting, right? So in dynamic retinoscopy, keep it in mind, this is very important, that in every type of dynamic retinoscopy, the accommodation of the patient is exerted, right? Accommodation is not at rest, accommodation is not paralyzed, but accommodation is exerted, right? In all types of dynamic retinoscopy. So we have many lectures on the static retinoscopy, and you know that you know very well about the with movement, against movement, and the neutrality. So the with movement, against movement, and the neutral points, right? So what is actually the with movement? You know very well that we find with movement. What is with movement? When the streak which is on the patient's pupil and the reflex which is inside the patient's pupil, both are moving in the same direction, right? That is called with movement. And when both of these, reflex and streak, are moving against, right, opposing each other, that movement is called the against movement. So what is actually the with movement? With movement, we will find with movement in those patients, like in a normal person like emetrope, right, in hyperopic patient, or in myopic patient as well. But the condition is, in myopic patient, the myopic value, the myopic correction should be less than 1.5, should be less than minus 1.5 severe. In all of these conditions, like in emetropia, hypermetropia, in myopia less than minus 1.5, we will find the with movement. And now we will learn about the indications of the dynamic retinoscopy, means that in which type of patients we will perform the dynamic retinoscopy, right? So number one is in every suspected cases, in every suspected case of the vergence, you know, the convergence and the divergence, number one. Number two is in every dysfunctioning of the accommodation, if the accommodation of the patient is fluctuating, right? Either it is so high, more than the normal, if patient is exerting more than the normal of accommodation, so it is dysfunctioning of the accommodation, right? And if the patient is exerting lesser than the normal, then this is also an abnormality of the accommodation. So in every type of dysfunctioning of the accommodation, we will perform the dynamic retinoscopy, right? The next is in every complaint of the near, right? If we find near headache, right? If patient complains near diplopia, if patient complains near asthenopia, if patient complains any complaint in the reading, any complaint on writing, then we will perform the dynamic retinoscopy. And the most important indication of the dynamic retinoscopy is lag of accommodation and lead of accommodation. So what is actually the lead of accommodation and lag of accommodation, right? So when we are saying that lag of accommodation, the patient is of lag of accommodation, then we are actually saying that patient actually requires accommodation of +2 sphere, right? This is requirement of the patient, but patient is exerting less than +2, right? Requirement is of +2 and patient is exerting +1, that it is actually less than the requirement. So this is called lag of accommodation, right? Patient needs more but patient's exerting less accommodation. This is called lag of accommodation. This is more simple, right? And what is lead of accommodation? When we are saying that lead of accommodation, we are saying actually that the demand of the patient, the requirement of the patient, the requirement of the accommodation is actually +2, but patient is exerting more than the +2. Patient is exerting +3 or +4. This is more than the demand. This is more than the requirement. So this type of dysfunctioning of the accommodation is called the lead of accommodation. So this is the most important indication of the dynamic retinoscopy. So if you find that patient is of either the lag of accommodation or the lead of accommodation, then you will perform the process which is called the dynamic retinoscopy. And now let's start the different types of dynamic retinoscopy. So the very first type of technique of dynamic retinoscopy is the Sheard's method of the dynamic retinoscopy, right? So what is actually the Sheard's method of dynamic retinoscopy? Sheard's method is actually introduced by the scientist, you can say, the Charles Sheard in 1920, right? This man, this great man actually introduced this beautiful topic, beautiful type, beautiful technique of the dynamic retinoscopy, which is called the Sheard's method of dynamic retinoscopy, right? So now we will discuss, now we will learn that what is actually the Sheard's method in dynamic retinoscopy. Now first of all we will learn that what is actually the indication when we will perform the Sheard's method, when we will apply the Sheard's method. So remember, keep it in mind very carefully. Then when you want to know about the lag of accommodation, right? When you want to know the value of the lag of accommodation in a patient, then you can apply Sheard's method, right? So now we will learn that what is the procedure of the Sheard's method. So first of all, your room illumination should be minimum, right? The retinoscopic light should be very illuminated, right? And but the room illumination should be very dim, right? This is indication. And remember one thing, this is very very important, that in every type of dynamic retinoscopy, I repeat, in every type of dynamic retinoscopy, you are not going to deduct the working distance. I am writing on the whiteboard in capital, no working distance deduction in dynamic retinoscopy, right? So I repeat, you are not going to deduct any working distance from the neutral points in dynamic retinoscopy. If we compare the static retinoscopy with the dynamic retinoscopy, keep it in mind that the static type of retinoscopies, right? In static retinoscopies, we always deduct our working distance, and static retinoscopy used to find the refractive errors. If we want to correct our myopia, if we want to correct our hypermetropia or astigmatism, we will go with the static retinoscopy, not dynamic retinoscopy, right? And in static type of retinoscopy, which is used to find the refractive error, we have to deduct the working distances from the neutral points, right? But in this case, in dynamic retinoscopy, you know that in dynamic type of retinoscopies, these types of retinoscopies like dynamic retinoscopy is not used to find the refractive errors. As we have mentioned, as we have discussed, the indications of the dynamic retinoscopy, right? It is used to find lag of accommodation, lead of accommodation, divergence problems, accommodation problems, right? Near blur, near asthenopia, near diplopia, near headache. In all of these complaints, we will perform dynamic retinoscopy. But if we are going to find refractive errors, dynamic retinoscopy is not usable, but static retinoscopy, right? So we are not going to deduct working distance from the dynamic retinoscopy, neutral points in dynamic retinoscopy. So the question is, why? Why we are not going to deduct the distance from dynamic retinoscopy? The answer is that in dynamic retinoscopy, they said the dynamic retinoscopy is always used to find the lead of accommodation, lag of accommodation at specific working distance. Actually, the dynamic retinoscopy is used to fix the problems at near, right? So in dynamic retinoscopy, I'm talking about the adults, right? The working distance, right? From where you are going to perform the retinoscopy. I am optometrist and patient is before me, and I am going to perform dynamic retinoscopy and patient adult, right? Then working distance, the distance between the retinoscope and the patient should be 40 centimeter, right? Or the working distance of the patient, which is desire of the patient, which is requirement of the patient. If patient is want to work at 40 centimeter, then the working distance between the patient and the retinoscope should be 40 centimeter, right? So that's why we are actually correcting the problem of accommodation at near. So distance should not be deducted from the neutral points in dynamic retinoscopy, right? In case of static retinoscopy, actually we are going to correct our astigmatism or a hypermetropia or myopia. So we have to deduct the working distance in static retinoscopy because we are going to wear our glasses at this distance, not at this distance. So to find the correct prescription of our glasses, we have to deduct this working distance from the neutral points, so we can get the best corrected prescription in our glasses, right? I hope this is clear. So now we will start our procedure of Sheard's method. As I have mentioned that in Sheard's method, we can only find the lag of accommodation. If you are going to find, if you want to find the patient, the lag of accommodation in a patient, then you can go for the Sheard's method of dynamic retinoscopy, right? So the procedure is, first of all, you have to perform the static retinoscopy of the same patient, which is actually came with a complaint of near blur, near asthenopia, near diplopia, like this sort of complaints. Then to perform the Sheard's method or to gain the lag of accommodation, first of all, you will perform the static retinoscopy, right? The static retinoscopy is you have to deduct the working distance, right? So you will make the patient to look at distance, right? The patient will look at the distance. Keep it in mind. To start the Sheard's method, first of all, the first step is you will perform the static retinoscopy, right? You will make your patient to look at distance, so accommodation should be at rest. I'm talking about the static, not dynamic right now, right? So in static retinoscopy, the patient will look at distance, so accommodation should be at rest, right? So suppose when you perform the static retinoscopy, the optical cross is, in static retinoscopy, as the accommodation is less, so at vertical meridian the neutral point is +4, and in horizontal meridian, in 180 meridian, the neutral point is +3, right? Working distance is the same, 67 centimeter, and you know very well, we have discussed many times the conversion. We convert 67 centimeter into dioptric form. Formula is d is equal to 1 over f, you know very well. So it is 1.5 diopters. This is working distance. So we have to deduct this working distance from the neutral points. So we will deduct our working distances from the neutral points. So if we deduct minus 1.5 from +4, my math is very weak, so it would be 2.5 plus 2.5, and if we deduct 1.5 from plus 3, the answer would be plus 1.5. You know very well. You know very well the procedure of static retinoscopy, right? So in this case, I repeat, the patient is looking at distance. The accommodation is at rest, right? So we can, this is sphere. We can consider this prescription or this neutral point is our spherical correction. So 2.5 is our spherical correction. So to find the cylinder, we have to move from plus 2.5 to plus 1.5, right? So the gap between both of these values is 1, right? So what about the sign of the cylinder? Actually, we are moving from bigger plus to lesser plus, so we are actually moving towards the minus sign, minus side. So the answer, the sign of the cylinder would be minus. And you know that what are the axes? Actually, our spherical is on 90 meridian, so axis would be 90. So the final prescription of static retinoscopy is, I can write it here, that static calculation is plus 2.5, cylinder is minus 1, axes are 90 degree. So this is static. In static type of retinoscopy, our patient was looking at distance and his or her accommodation was at rest. His accommodation was at rest in static type of retinoscopy. And now we have gained the value, we determined the value of the static retinoscopy, right? So now, after this, the next step is of dynamic retinoscopy, which is actually implanted on the retinoscope, on the head of the retinoscope, and you can see that values are written, some writing material are written on the patients, on the retinoscope, on the head of the retinoscope, on that card, as you can see on the screen. So you will ask the patient to look at that reading chart on the retinoscope, and when he will look at those optotypes, then accommodation of the patient will be maximum, because he is looking at near, and you know that when patient looks at near, the accommodation is at maximum, right? So when the patient is looking at that card, then actually he is using his accommodation, right? And the distance between the patient and the retinoscope is 40 centimeter, because patient likes to read at 40 centimeter, right? Keep it in mind that if you want to make a distance, if you want to perform dynamic retinoscopy in adult, the working distance should be 40 centimeter, and if you want to perform dynamic retinoscopy in a child, right, then you will use a Harman's distance. And what is actually the Harman's distance? The Harman's distance is actually, you will ask your patient, which is a child, you will ask the patient that he will make a fist, and he is not going to punch you, but he will put his or her fist beneath his or her chin, and the distance between this fist, upper side of the fist, to the lower side of the elbow, this distance is called the Harman's distance. In adult, the distance should be 40 centimeter. In children, the distance should be Harman's distance, right? So we are going to perform retinoscopy, dynamic retinoscopy in a patient which is adult. So the working distance is 40 centimeters. So suppose we are going to perform dynamic retinoscopy Sheard's method at 40 centimeter, right? And you know that actually the patient is of lag of accommodation. What is lag of accommodation? The least of plus power in the eye, you know, lag, right? Requirement is more but exertion is less, right? So it means that patient's eye needs more plus, but eye is unable to exert accommodation, eye is unable to increase the plus power, so there is a deficiency of plus power in the eye. So whenever there is deficiency of the plus power, we will find with movement. So in every type of patient which is of lack of accommodation, we will find with movement, right? So in every case of with movement, we always neutralize the with movement with the plus spherical lenses, right? So we will perform dynamic retinoscopy at 40 centimeter, and we are we have found the width movement in patient's pupil, and we are going to neutralize that width movement with the plus spherical lenses. So in dynamic retinoscopy, the procedure is the same as the static retinoscopy. You are going to neutralize that width movement from the both of the meridians, right? But the difference is you are not going to deduct any working distance from the neutral point. So suppose in dynamic, now this is static and this is dynamic. The values of the dynamic retinoscopy, suppose, so the neutral point, actually the values, the neutral points of the dynamic retinoscopy are always higher than the static. Why? You know that because in dynamic retinoscopy, patient was looking at near, and when patient is looking at near, the value would be high because patient is exerting accommodation, right? So the dynamic retinoscopy, in dynamic retinoscopy, the working distance, sorry, the neutral points always will be higher than the static, right? So suppose at 90 meridian, our neutral point was plus 6, or you can say plus 6 is more. You can find, we can suppose that plus 4 is all right, right? And in this meridian, this is of plus 3, right? So this is spherical. We have considered this value as spherical, and you noticed that I'm not going to deduct any working distance from the neutral points. This is actually the main difference. This is actually the major difference between static and dynamic, right? So these are only the neutral points, and I'm not going to deduct any of the working distance, right? So plus 4 is our spherical, and when we are moving for our cylinder, when we move from this side to this side, the answer is 1, and we are actually moving from plus 4 to plus 3. So with greater plus to lesser plus, the sign would be minus, and the sign is axes are 90 degree. So this value is plus 4 with minus 1 cylinder at 90 degree, right? So this is dynamic. This is answer of the dynamic retinoscopy. Static is this one, dynamic is this one, right? So to find the lag of accommodation, we are actually going to deduct static retinoscopic values from the dynamic retinoscopic values. So this is the value of the static retinoscopy, which is plus 2.50, and this value is of dynamic retinoscopy, which is plus 4. So now to find the lag of accommodation, we have to deduct static retinoscopic value from the dynamic retinoscopic value. So to find lag, dynamic minus static. So what is the value of the dynamic is plus 4, static plus 2.5. So when we will deduct 2.5 from plus 4, the answer would be plus 1.5. So is this our lag of accommodation? No. Then what is actually the lag of accommodation? Keep it in mind that in every normal person, right, there is always a normal lag of accommodation. If I am 6 by 6, if I am emmetrope, then I already have my lag of accommodation. If my eyes want to get accommodation of plus 2, then my eyes will get accommodation of 1.5. There is always a lag of accommodation of 0.5. So 0.5 or 0.75 is a normal lag in every type of person, in every type of normal person, right? So we have to deduct that value as well. So when we deduct static from dynamic, the answer was plus 1.5, and now we are going to deduct the normal lag, right? And what is the normal lag? That is minus 0.5. Then 0.5 is actually the normal lag. We have to deduct this value as well. So the answer would be plus 1. So this plus 1 is actually our lag of accommodation. So that was all about the Sheard's method. As we have discussed in the beginning of the lecture, that the Sheard's method is used to get the lag of accommodation. That was all about the Sheard's method In the very next video, we will discuss about the MEM method, monocular estimate method, which is very important type of or technique of the dynamic retinoscopy. We'll see you in the next video.